Well, let me tell you, we really appreciate all of our sponsors. The work that we do.
No, just move over this way so I can get you in the video.
What?
Just move. You just need to move over.
Oh,
Not the video.
okay.
You. Good.
Thank you. My director here says he's filming. I move around a lot, your camera's gonna have to follow. So we need to update this slide, that might be my fault. But anyhow, we really rely on our sponsors, and we have a banner here, but we really rely on our sponsors for what we do. And so for those of you who are sponsors in the room, and I know we have a few sponsors in the room, thank you so much for everything. For those of you who attended our dinner just this past month in February, we recognized a lot of our sponsors, and a lot of our sponsors were there at the dinner. We can't do the work that we do without our sponsors, so we always really shout out our sponsors and say thank you so much. To our board members, I know there's a few in the room tonight. If you're a board member, can you please stand? All right. Connect with, including myself, if you want to know anything, if you have any question. All of our board members are a volunteer board. They are a very active board, and we appreciate everything they do as well, so thank you guys. All right, so our vision, our mission, our values. If you've been on our website, if you're a member, I hope you know these things. But we're really here for our healthcare professionals in this community to provide education, to provide networking opportunities, and to provide a place where you can learn and meet people and, really carry out the mission of this professional organization. Here's our entire 2024 board. There's a lot of us here tonight. Some of us couldn't make it, but throughout the year, all of us attend different events. And so I encourage you to reach out to anyone on the board. On the website, it's very easy to connect with us. Also, I'm sure I have something in here about LinkedIn, which I'll talk about. So ACHE is a national organization. I'm sure you guys know that. Here's some stats that I think are very impressive stats of how big and how wide-spanning this organization is. It is a nationwide organization. But more impressive than that, I think, is our South Florida chapter. We have over 1,000 members in our chapter. 139 of those members are fellows, which is very large. I think I said this at the dinner if you were there, but we're the 9th largest chapter in the nation. So a very large chapter, and South Florida has always had a tremendous number of fellows. So for any of you new members or members who have been part of the chapter for a while and have considered fellowship, if anybody in this room is a fellow, can you please raise your hand? All right, so these are the people you could talk to if you are interested in fellowship or have had, a desire to pursue a fellowship. These are the people who can kind of guide you through it. I know some of you have reached out. I'm looking at my friend here who reached out, and she's going to take her test soon. But the board is always happy to answer any questions, share any study materials. Am I telling the truth? And just give tips and so forth. So it's something in our organization that we're very proud of. 252 student members. How many of you are student members? Awesome, great. And we have great partnerships with our school. I see our NSU person back there who's also a platinum sponsor, also FIU, FAU. We have a lot of Barry University, a lot of partnerships with our school, and we appreciate that. Okay, LinkedIn. I would be remiss, and Adrian's not here tonight, but he texted me. He's on a trip for work, and he texted me and said, "Harula, make sure you mention LinkedIn." So, if you did, we have a goal of how many followers we want for LinkedIn. So we had a 4,000 follower goal, which we met. But now he told me that by the end of this year, he wants 5,000 followers. So if you are not following us on LinkedIn, please do. Connect with us on LinkedIn. All of our board members are on LinkedIn, so you can reach out to us there. But we post everything on our LinkedIn, from our education events to our networking events. And to everything that we have going on. So it's a great source of information. So please follow us on LinkedIn. And if you see Adrian Parker, you tell him that I made sure to shout out LinkedIn. Oh, look, I even put this in here. So you guys can scan this to follow us on LinkedIn as well. Okay, so I think that we're going to get started. We have a great panel tonight. I'm going to introduce our moderator who's going to kick us off. But before we do that, I want to thank our host facility. Thank you so much for hosting us, for the spread of food, for this beautiful room. We appreciate it. Again, I told you guys we are a volunteer board, so we look to our local healthcare community to host events and so forth, and we appreciate you hosting us this evening. Thank you so much. Okay, Andrew Sinclair, come on up here. He is going to be, he's the regional manager of patient experience for Broward Health North, and he is going to be kicking off our panel tonight, so I'm going to hand the microphone over to you. Thank you guys so much.
I Actually, I'm gonna invite my panelists up as well, because I don't want to be on stage all by myself. So while they're coming up, thank you for the generous introduction. My name is Andrew Sinclair. I'm the manager of patient experience at Broward Health North. We're located in Deerfield Beach, Florida. Been with Broward Health for about 10 years. And so welcome to the ACHE of South Florida panel discussion on meeting the needs of today's healthcare consumer. I'm honored to host this discussion with three transformative healthcare leaders, not only with expertise here in the South Florida market, but who have also national acclaim. Our panelists will be sharing their views on meeting the challenge of delivering healthcare to consumers in a meaningful, efficient, and economic way. I'm going to ask them to introduce themselves, but before I do, I would like to take a minute to thank the ACHE of South Florida for inviting me to host this wonderful event this evening. And specifically, I would like to thank Charles Felix and Juan Awad for putting this wonderful event together. So thank you to our panelists for joining, and I will turn it over to Sandra and ask her to introduce herself.
Good evening. Hi, good evening everybody and welcome. My name is Sandra Sneed and I am the Chief Operating Officer for Memorial Regional Hospital. We're the flagship hospital, 700-bed, level 1 tertiary quaternary trauma center in Hollywood. And we are the flagship Memorial Health System. We have 5 additional hospitals. And so I am happy to be here. I've been in ACHE for over 15 years, and I've been a fellow for probably 10 of those years. And I look forward to sharing whatever knowledge I can impart.
Good evening. My name is Nancy Poviones Gonzalez, and I am the Assistant Vice President of Patient Experience for Baptist Health South Florida. We proudly serve our families throughout West Palm Beach, all the way down to the Florida Keys. So we are happy to serve and provide healthcare for all. And I look forward to chatting with you guys tonight, and we can communicate and learn more about patient experience and how it affects our communities that we serve.
And we have one more special guest that's going to make an appearance in just a second.
Sir, can you folks hear me?
I think we can hear him.
There he is.
There he is.
And I apologize for I'm John Munoz. I'm sort of healthcare. We have hospitals in Lauderdale area, hospitals throughout the country. I may have known for years as a tenant at 5 Miami hospitals. That's this one. So happy to be here and happy to use healthcare. It's wonderful. Thank you.
Dr. Diaz. Okay, so my goal in this panel is to help us get a better understanding of today's healthcare consumer, their needs, and how we adapt to our ever-changing healthcare environment. But I'm going to need your guys' help. So I'm going to ask that you guys ask some questions. You can raise your hand, and I'll make time throughout our presentation for these questions that I'll weave into our discussion to further our conversation. So let's get started. The first question I'm going to ask, I'm going to direct this to Sandra. What is the experience the consumer, patient, really wants from a healthcare organization?
Okay, so meeting the needs of today's healthcare consumer. So let's look at some of the trends that we're seeing among consumers. How many are familiar with the switch from patient to consumer? Okay. It's new in different markets where we now call patients consumers. I remember when I first heard it, it annoyed me because I came into healthcare over 30 years ago. These are patients. What do you mean? They're patients. But now we look at them as consumers because they have choices. Today's consumer is more educated and they have lots of resources. They do a lot of research prior to picking. Especially for preventive care or specialty care, they do a lot of research before picking a facility. So what's important? According to the advisory board, and the advisory board is a think tank out of Washington, D.C. Lots of knowledge, lots of research, and they're a great resource for hospital trends. according to them, 66% of patients who were seeking primary care and 68% of patients who were seeking specialty care look at wait times. They look at access, location, cost, and wait times. How long does it take me to get an appointment? And so when we look at patient experience, making a great experience, so when patients come to the hospital, quality care is a given, but how do we make them feel? What's the experience we provide? But now, that's only a baseline. That's like a table stake. What now we have to do is, what's parking lot? What is that like? Do we have locations in the market that's easy for people to get to? Do we have good wait times? Do we have, in the ED, for instance, how do we manage wait time? There's something called wait time sensitivity. So all of that is a much broader view of patient experience. It's not just making sure that we do service recovery, that we say thank you, that we introduce ourselves when we go into the rooms, that we explain to the patient why I'm here. That's all basic now. It's what kind of access are we providing for our patients? Again, are we strategically put in the market where we can have access, locations that are convenient, and hours, flexible hours? Are we also looking at Saturday hours, for instance? Do we try to meet the consumer? So those are some of the trends that are driving how we meet those needs.
Well, that was excellent. I'm gonna add to that, and obviously access is such a hot topic. We're all in that. When we want something, we're used to getting it almost immediately nowadays, right? So with healthcare, it's very frustrating that when you need healthcare, you may have to wait weeks or months for an appointment. So access is very important. Creating digital platforms where the patients can feel they can connect with a healthcare organization. But since you touched upon that so well, I'm gonna kind of go more onto the insides of a hospital. So many of our patients come to us through the emergency department. They didn't want to come, they had to come, right? So now they're in the walls of our hospital, and how are we caring for them, and how are we providing them with what they need? Involving them in their care, doing bedside transitions, showing them teamwork amongst the leaders, showing them teamwork amongst the ones providing for care on a daily basis, reviewing with them, making them a part of what's taking place in their body and in their healthcare. Transitions of care are so important. How are we helping this person navigate to the next step? Because again, we go back to access. They leave the hospital, but they have to make 10 appointments. So helping them with those transitions of care. I think patients are looking for us to lead the way from entry to exit through the full spectrum. So it's very important that we're able to meet those needs in the way that they need us to.
Yeah, I guess it's my turn, but I was told it's not speaking loud enough. So can you hear me?
Yes.
Can you guys hear me okay?
Yes.
Yes.
So I'm hearing two things. So from both Kendra and Nancy mentioned coordinates several times. When we got to think really put this emphasis on the team, and what made this thing that I care about as far as access, maybe something different to another person that's seeking healthcare at our facilities. So access may mean things for me like making the nice phone an issue or a concern. To another person, thinking that there's an easy part and easy to get it in outpatient, etc. So when we look at the consumer, not the consumer who wants healthcare, it's not necessarily fit all. Even though we can search back and talk about research innovation, the digital place, really have to think about individually patients into each patient's experience. So somebody may want anxiety, someone else may want something that's fuzzy. Maybe someone just wants quick and pretty, get it, and no frills. another person may want a significant amount of attention that maybe we need. But all of us to consider, how do we look at tourism and health and approach it from perspective into taking care of those communities and those regions.
Thank you, Dr. Diaz. Thank you all. That was very, very interesting. My next question is going to be for you, Nancy. What can healthcare organizations realistically provide to our patients in today's environment?
Well, there's so many things that we need to provide to our patients. We obviously have a responsibility to provide professionals such as yourselves that are ready to provide the care that's needed at a variety of levels. But it's not just important to have the education and to be a professional, but to be able to connect. And overseeing patient experience for a system as large as Baptist, really, I get to hear the voice of the consumer and what they need. And at their most vulnerable time, they want to connect. They want to feel that they're being well taken care of, not just from their particular diagnosis, but holistically. So I think that that's very important, and that is most definitely something that we can provide. Of course, we also need to connect with them on the bigger scale, from, as we discussed, from access to ensuring that they can get the care that they need once they leave our doors. And, a lot of times I think of patient experience, and I think of that is our time with the patient when they're inside our doors, for us to educate them about what their disease process is, the medications that they're taking. They need a variety of things from us, not just for us to care for them, but they're going to leave our doors, and how do they care for themselves once they leave? So, one of the projects that we're working at Baptist is that, right? Educating our patients about their medications, making sure that they leave with the tools they need to care for themselves. And there's, it's an endless conversation of what we need to provide for our patients. But I think that those are very important ones.
Another thing too, if you think about patient experience, when it's so working in a very large hospital such as I do right now, it's easy to get caught up in the business of running a hospital. We're fortunate through a lot of the work of our HR department and our CEOs and our CNOs that we have a good nursing ratio. But we have a lot of newer nurses. And so part of that is, how do we train them to still deliver the care, but to show that they care for the patient? How do they take time out to listen? And that every patient today, we had a seminar at our hospital, and one of the things that's a reminder is every patient has a story. And nobody gets up and says, I want to go to the hospital, at least not inpatient. They don't. So I think taking time out, it's old-fashioned to some degree. How do we still show, and how do we enable our staff to be able to take care of patients, again, clinically appropriate, but also showing the compassion, taking time to listen. I think those are really important in creating a patient experience, but being sensitive to what that patient is going through. So I want to get back to the ED, because the ED is the front door to most hospitals, and most hospitals have anywhere from 70 to 80% of their admissions are from the ED. And so that is a challenge. And what I've seen over the years is that ED overcrowding is becoming a problem in many, many cities. And so we're not immune to that in Hollywood. And two of our largest hospitals are a challenge with that. So how do we manage ED overcrowding? And again, like I alluded to in the beginning, it's not just patient experience. Yes, being kind, listening, introducing yourself, explaining the procedure, but it's also, as a COO, I look at the efficiencies. I look at, what are the processes in place? And so, again, you look at your ED, do we take time out to see how long a patient's been waiting? You know, do you offer them a blanket? Do you, I round in the ED a lot, so, you know, what do you do when you see somebody waiting? Sometimes just stopping and listening and saying, you know, you'll be next, or going and checking, you know, with the physician and see when is this patient gonna be up. Because what I found is when people are waiting, you can mitigate their frustration by giving them information. Nobody likes to sit there for an hour and not understand why. And so, again, how do we take time out, whether you're administrator, whether you're a clinician, whether you're a manager, to take time out of your busy schedule to let that patient know, communicate with them. So those are some of the things I think are important in providing a patient experience.
So the question is, healthcare organizations realistically, what can healthcare organizations realistically provide for patients? You know, and I would say that really this goes back to how much competition we have for every single dollar in the healthcare system right now. And God knows it's a challenge for all of us to try to figure out how we're going to appropriately spend those dollars to get the best possible contact with our patients. At least as it references on the consumerism side. What I would recommend, and this is something that we are seriously looking at Steward, we have not taken the step yet, but you truly need to have a team that is specifically focused on how you can carve out a section of time, effort, energy, and money to create a technology facilitator role within your organization. That's where things begin to really take place and how we can begin to develop a lot of the processes that consumers are really looking for in today's healthcare environment. It is without a doubt an expensive venture, but one venture that if we don't start, if we haven't started by now, we're really going to be behind the times. So whether it's one individual, an organization, or whether it's a team approach, I strongly believe that a technology infrastructure dedicated to see what we can do to facilitate that encounter and customize it to the individual patient is really going to be critical to our success. But you know, I'll also go one step further and just say that it's really also important to you know, understand that it's all about how easy it is for a patient or a prospective patient today. They see a lesion on their hand or their skin, or they have a cut or a bruise. They take a picture of it and they send it. I'll give you a personal story. Just 2 days ago or 3 days ago, I had a neighbor of mine fall and injure his face. So he took a picture of it and sent it to me and said, well, what do you think? Should I go to the emergency room? Should I, you know, just sit at home, put a Band-Aid on it? So it's amazing what this technology can do and really be helpful in understanding what the next step that you need to take in your healthcare. So we need to move forward in some kind of facilitation role for that technology in all of our hospitals. That's how I would answer that question to the best of our ability. And we can start providing that literally right now.
And that's perfect, because this leads me right into my next question. I'm going to direct this one to you, Dr. Diaz. How can we meet patient and provider needs in a better, faster, and cheaper way, while we also are eliminating waste within our systems?
Yeah, and I appreciate that, Andrew, because that's essentially goes right into, and I was actually going to begin answering the question with the answer that I gave to the previous question. So again, think about how many times you look at, you're watching a movie, for example, sitting at home on the couch, and you see some movie star that you haven't seen in years, and you're like, you pick up your phone or you go to Google and you say, hey Siri or hey Google, how old is, you know, Tom Cruise? And you get the exact age and you figure out, oh yeah, he looks better than I do, and you know, I'm younger than him. So those are the kind of things that we can do today, and it's so easy to do. So I would say that, you know, again, we need to understand what technology can bring to us. And it isn't reinventing the wheel. There's so much out there already that we can take part of and really get involved. You know, also, if you look at, or if you just go on Google right now and you say, Google, tell me about healthcare consumerism, or tell me what healthcare consumerism has done over the course of the last year. almost every single thing we look at will make a reference back to COVID. Almost everything we look at says, geez, everything changed during the COVID years. And God knows, we all know that things in healthcare truly did change. But as you move through what COVID taught us, it really taught us to rely on things that we never thought we'd be able to put into motion as facile as it is today. Like telemedicine, especially those telemedicine providers that have multi-state licenses, where they could be in New York and be able to handle a case in Florida or in California. So really, it all comes down to how we can apply that technology in a cost-efficient and cost-effective manner. I would set aside the whole artificial intelligence thing for right now. I don't know if that will come up later on or not, Andrew, but artificial intelligence, I think, is not quite right yet for healthcare, although some systems are beginning to use it. And that may be another topic for HCHC to use down the road, but AI will certainly play a pivotal role one way or another in our future as healthcare providers.
Just to piggyback on what Dr. Diaz said too about AI, I think AI, artificial intelligence, is exciting, but it's a tool. It's only a tool. And I think as it becomes more sophisticated and more organizations adopt it, it'll be helpful to us, but it's still going to take processing and putting it in place. But some of the other things, our system is very hospital-centric. And we are looking at moving more into the community. And again, as we look at that as an organization, Memorial Healthcare System, we do look at where in the market do we need to have urgent care centers, where in the market do we need to have more primary care offices. So I think that's one thing that providers can do to meet the needs of consumers, is to look at your market, where are you placed, and where is your consumer, and are you placed in close to them? Because again, according to the literature, and just I know my own experience, nobody wants to drive much more than 30 minutes to get to a doctor. And how many people in here want to take off from work to go see a doctor or get a mammogram? So how about Saturday hours? We need to start thinking more about how do we meet that consumer today. Consumers, we're busy. All of us are consumers, we're busy. And I know one of our CEOs is sitting here, so I hope she'll forgive me. But when I have like a cold or I just have like some minor thing, I will go to a retail clinic. I've done that in 2 different markets that I live in. Now here, I've gone to, Memorial has a really good urgent care clinic on Pembroke. So I'm not pushing my organization, but I really do. But in other markets where my own system, I said, I've been to the CVS Minute Clinic. But what does that tell us? Those are disruptors. Amazon, Walgreens, Walmart, CVS are disruptors. They're tapping into what consumers want: convenience, easy location, quick turnaround. And so how do we compete? Like if we are expanding into the market, how do we organize our primary care practices? What about same day or next day appointments? Or what about an appointment in a week? Those are the kind of things that we can do as providers to be more responsive to today's consumer.
So I believe the question had a lot to do with digital platforms, correct? So, to your point of making ourselves accessible and joining into the communities, Baptist Health, unlike, we're just like every other organization, we're doing the same, checking the market, how can we reach our consumers, whether it's through urgent cares or emergency departments throughout the communities, but also those digital platforms. And as you were talking, I had a thought of my own experience. I was with my family in Puerto Rico on vacation, and one of my children had some weird skin situation going, and I was able to get on my Pine app which is our digital platform. And from Puerto Rico, I was able to FaceTime a doctor, get my problem solved, get my kid the cream, and move on with my vacation. So, you know, access the digital platforms at your fingertips, being able to reach the consumer. So it's, you know, ensuring, I know that because I'm an employee of Baptist Health, but ensuring that our patients know that and that they have access to that kind of care. Just the same as we have hospitals in so many different locations, but for example, our hospitals in the Keys, sometimes it's difficult to get certain physicians to these critical access hospitals. So we are leveraging telemedicine, like Dr. Diaz was talking about, and you know, we now have telepsych, so that we can provide psychiatric care 24 hours a day, all the way down to Marathon. So it's really looking at how those digital components can help us in a wide array of ways. And I know there's a lot of students in the room, so it's gonna land on you, right, to continue to be innovative and to continue to think about your consumer and how you can leverage those digital platforms and technology and in the future AI to provide the care that they need. Because ultimately, they're the consumer, they're the patient, they're coming to us, and we have a responsibility to provide.
Thank you, Nancy. I think we can all agree that in the next 5 to 10 years, healthcare is going to look a little bit different with the advancements of technology and definitely AI. So in my experience in healthcare, it comes to sometimes find out that our organizations have some competing priorities. So I'm going to address this one back to Sandra. How can a healthcare organization excel in all these competing priorities in safety, in satisfaction, in retention, and translate that to our patients in our outcomes?
Just want to clarify, safety, satisfaction,
and then retention for our employees.
Okay. So patient safety is number one, and patient safety comes from communication. It comes from protocol-driven care. It comes from standardized, reducing variation as much as possible. So safety, it also comes from creating an environment where someone can say, stop, you know, this is not right. Or, you know, like there's almost every hospital over the last 10 and 15 years has instituted crew resource management. So in 1999, a book came out, To Err is to Human, and it scared the society because hospitals, that is still a very famous study, and I think it's still talked about in a lot of graduate healthcare programs, but it just showed the error rate in healthcare, and it was frightening. And so a lot of healthcare systems adopted crew resource management, which is borrowed from the airline industry. And one of the key parts of that is anybody could call, stop the line, or stop, or raise your hand. Anyone. It could be a surgical tech, it doesn't have to be the surgeon. But empowering people to speak up if something doesn't seem right can avoid a lot of errors and create a safe environment. So I think that's standard everywhere, but a high-performing hospital is going to have really strong protocols, standardized care, reduce variation, and keeping it safe for anybody on the clinical team to say, I have a concern, stop. The second thing about patient experience, again, as I alluded to earlier, most of us go into healthcare because we truly want to help people, so don't lose that. How do we convey that to the patient? And making sure you have things in places, scripts, okay, that may seem trite, but it's actually very helpful to have scripts about how we greet people. You know, not everybody knows how to greet somebody on the phone. You don't know if you've ever called the hospital and gotten somebody who was rude. So, you know, making sure we take the time to script our staff. How do we, even when you go into a room, you know, do you acknowledge the patient? Do you introduce yourself? Do you talk about the treatment that you're going to be given? You know, educating them, involving them. So those are some of the things that creating a good patient experience. What was the third thing?
Retention.
Oh,
The big
retention. Well,
The cloud that hovers over us.
trying to hire some imaging technologists right now. So, since the pandemic, as you know, healthcare, it was a mass exodus. The pandemic scared a lot of people, a lot. So then we went through a phase of hiring really high-cost personnel to staff our hospitals. Fortunately, many of us now no longer use travelers, and we have also eliminated incentive pay because financially they weren't sustainable. So again, employee engagement is important, and if you have an engaged workforce, that correlates with high patient experience. And how do you have an engaged workforce? Like communication, recognizing employees, giving them, recognizing them individually and collectively, empowering them. Even your frontline staff should be able to solve problems if you can. Some systems that where I've worked, we empower that person at the desk to do service recovery. You don't have to come get an administrator. You can empower that person to help a patient who's upset. So, I find that employee engagement, of course, compensation is a piece of it, but appreciation is also really important. And then creating an avenue like a career ladder. Most people want to move up. So, making sure we provide preceptors and we onboard our staff. And then how do we provide a ladder up and keep them in our system? So I think those are some of the strategies that answered your question.
Thank you. That was great. So yes, we'll go back to safety because safety is at the center of it all. We all go into healthcare because we want to help others. So helping them is keeping them safe. Safety has to be at the top every time. And for the students in the room, you'll hear a lot about being a high reliability organization, journey to zero harm. It's at every topic, at every meeting, at every conversation. Because to your point, there's too many errors and it's not okay. And we have a responsibility to keep our patients safe. If we're safe and we're kind and we're attentive and we communicate, patient satisfaction will come. It will follow. I think, ultimately when you're a patient in a bed, it's a scary feeling. And for your professional to walk in and communicate clearly and be consistent. I always, overseeing now the whole system from a patient experience, I think one of my main goals that they keep hearing out of my mouth consistently is consistency. We have to provide consistent quality care. It can't be 100% today and 75% tomorrow. It has to be consistent because that's where errors come in. And to your point, anyone should be able to stop the line. Everyone should know what needs to happen, and if they feel something is happening that's unsafe, they should and be able to say no and say stop and let's take a moment. And that's what happens when you're in an organization that values safety and high reliability. It's okay. It's not about titles. As far as patient experience, well, it's at every level, right? It's communication, it's connecting with your patient. And, a lot of times the staff feels overwhelmed and they have a lot on their plate, but you can't not connect. You have to connect because there's a human being on the other side. A scared human being at many times, or a scared family. A lot of times, when we're talking about with the directors of first impressions, the people at our front desk, just remember that these people that are coming to you, they're probably scared. There's very few that are coming in to welcome a new baby and they're excited to be here, right? Most of the time they're afraid. So it's being sensitive and being able to connect at the human level with the patients that we care for so that they trust us. Because if they don't trust us, then we don't have much going on. They have to trust us. And retention, well, I've worked in a hospital for almost 24 years, and so that's where I like to be. But it's about family. It's about teamwork. There's something about healthcare, and I keep referring to the students because it just inspires me that the room is full of students, because it's fresh and exciting and you want to make the world a better place. And I remember feeling that way, and I still do. But healthcare is about teamwork and creating an environment where we're working as a team, where others feel inspired by their team members. I'm huge into mentorship. I love to mentor others. I personally have benefited from being mentored and being groomed, and someone saw something in me. So I always try to do that for others, and I always inspire my leaders to do that as well, because that's how we retain our teams. They want to work with you. They want to be a part of something special. And yes, it has been so much more difficult after the pandemic. But I feel like we're starting to level off in some version of normalcy again. And sometimes we just have to go back to basics, right? Why did we come into this career? Why are we here? And what do we really want to do? And
Yeah, so excellent. Thank you so much. So let me try to answer this question. So excel at safety, satisfaction, and retention. So Andrew, I thought a lot about this question, and I thought, geez, do I need 3 minutes, 3 hours, 3 days to answer this question? And I thought, I need more like 3 months to be able to answer this question. So I don't think this is a fair one for this conference that only lasts 90 minutes. So, but let me just address that. Nancy and Sandra have really said a tremendous amount about our approach to patient safety, patient satisfaction, the journey to a high reliability organization. There's so many buzzwords I can throw out there that I think all of us as healthcare professionals have heard or toyed with at one point or another, because truly, like Sandra said, it is job number one, and we need to make sure that we are absolutely excelling. But I would caution that we can't lose sight of patient safety and high quality and our performance just because we're moving so fast into some kind of a digital platform, some kind of an app that will allow us to work faster and more in tune with what the consumer needs. So we have to keep a keen eye that, actually like Sandra and Nancy both said, that patient safety and high quality and high standards in the way that we carry ourselves as professional healthcare workers trumps everything else. And I would add then the last thing is that retention is not something I worry about at all, because if we're concentrating on providing a safe and healthy environment for our patient, retention will follow. We don't have to worry, or we don't even have to lift a finger to worry about retention, doing everything right for the patient and the delivering care.
Thank you, some great answers to my difficult question here. All right, so Nancy, I'm going to give this one to you. What are some best practices that you've seen work in healthcare, or maybe some other industries around for healthcare patient experience, but for other industries, customer care?
well, I think first and foremost, you must understand your customer, or in this case, for me, my patients. What are they looking for? Where are their needs? Listening to the voice of the consumer. We do that through a variety of mediums. You know, many hospital organizations do it through surveys, through whatever company you use, through the voice of the consumer, through HCAHPS, which is publicly reported. It's really understanding what they need. And I hate to say consistency again, but I'm going to, because they're looking for consistency. They're looking for, did you always care for them the way they needed to be cared for? When they were in pain, did you always provide them with what they needed at the time you needed it? You don't need a pain pill an hour from now, you need it now. So it's really connecting with where they're at, right? And in healthcare, it's such a wide spectrum, because again, maybe your patient is on a digital platform, telemedicine, and what their needs are very different from the one in ICU who may be passing. And what we're caring for is the family and comforting them in their time of need. So it's such a wide spectrum of getting it right so many times in so many different ways. And it goes back to, I think, really commitment, that human commitment to connect with the individual that we're helping and providing them with what we need. And you have to have that little bit of intuition and everything you learned along the way to continue to always connect and provide at the level that they're requesting and requiring from you at that moment in time.
Well, Nancy is so thorough, I'm not gonna be redundant, but I want to get back to, just with earlier, we started the panel discussion with access. So some of the best practices are innovative, and I've only been in this market for 2 years, not quite coming up on it, but I've worked in several markets, and so I've seen different things. And so let's, if you think about, again, we talked about EDs being the front door to most hospitals, and we talked about how 70 to sometimes 85, 90% of your admissions come from your ED. So consumers also like to anticipate wait time. And one of the things I've seen, I've spent many years in the Detroit market. I worked in 2 different systems there, very competitive healthcare market. And you could pull up on your website, and I think it's done here, I've heard of it. You can pull up on your website, you wanna go to AED, you can pull up the wait times. And you could actually look and see. And so some of the innovative things that some systems are doing in some markets are making their compare wait times, putting that in their websites. I've even seen it on billboards. So those are the kind of things that are best practices from as far as improving access and taking advantage of the innovation. Your organization can partner with retail, like Rush University out of Chicago, University Hospital, is partnered with CVS Health, Accountable Care Organization. That's pretty innovative. I just saw an article about it. But again, that's another way, if you're like into strategy, most of you all here are administrators, when you're looking at how to improve access, convenience, price, and location, how can you partner with some of the retails, giants that are trying to come in and disrupt healthcare? So those are some of the innovative ways that you can apply best practices from other industries, from other markets to see if they would work in this market.
Yeah, and I would echo that when we look at other industries, I think at one point or another, all of us have brought our car into a dealership, and we see how dealers go above and beyond to provide, a comfortable environment, a waiting environment of some kind. They usually have a coffee machine, not very good coffee, but they usually have a coffee machine, and they usually have internet access, and et cetera, et cetera. Even if you're going to a tire shop to change a tire, nowadays they provide free internet access for you as well, et cetera. So those are little individual things that can be done in any industry, including the healthcare industry, to make the consumer experience better. But I'll call it another industry, the airline industry. And I was recently fortunate enough to get surveys on American Airlines that said on the boarding process, did the person boarding you, the gate agent, look at you in the eye, call you by name, did they thank you for flying, etc. And when I looked back at one particular flight that I took, which was the one that they were asking me about, I said, yeah, they did. In fact, I do remember that the agent at the gate said, thank you, Mr. Diaz. And I remember that flight attendant saying, thank you so much for flying with us, etc. And those are the little things that take that consumer experience, just being another number, number 238 getting on that airplane, sitting in that seat, and they diffuse that and make it a little bit more personal, so you feel that somebody was actually looking at you as a human being and not as another person marching down that single aisle airplane to sit in that middle seat. Those are the kind of things that the industry can do to make you feel like an individual. Keep in mind, though, that every single person, and I've said this before to a lot of my crew, every single person walks into our healthcare facilities, any of our healthcare facilities, and it doesn't matter if they're a visitor or a patient or a relative, 100% of the people are either anxious or stressed in one way or another. even those mothers that are coming in to deliver a baby, which is one of the happiest moments of life, there's still a significant amount of anxiety and stress that goes along with it. So when you pass someone in the hallway, you don't know what they're carrying. You don't know the heavy load that they may be facing. They may have gotten a bad diagnosis in an imaging study. They may have had a loved one pass away. They may be coming to visit someone who they know is going into a complicated surgery. And that compassion and individualization for those individuals is critically important for us. So take a lot of what we see on a day-to-day basis out there in other industries, car dealership, airline industry, etc., and try to then convert that to a little bit more compassionate approach, knowing that everyone in our healthcare facilities has one ability or one heavy load on their shoulder one way or another. And a little compassion and individualization, I think, go a real long way to helping ease that pain.
So Sandra, in your last answer, you talked about innovation, and I kind of want to circle back to what we were talking about before with technology. What are some new technologies, whether currently affordable or not, that you think can aid in increasing patient satisfaction?
Is that what you want to be?
I'm going to get that one to Sandra.
Okay.
Okay, some technology that I've seen work well. Let's see, well, one thing I've seen work well is online check-in, where the system that I came from, you can check in for your appointment online. I've also seen, we had kiosks in all of our outpatient facilities. Only thing is, one time I was there myself getting treatment and I saw a senior citizen struggle with it. So we just need to be cognizant of technology, that there's still a lot of I think the first generation, my mother would be part of that, but some of them still living. They're mostly folks like over 75, 80, that's that generation. Then there's the baby boomers, Gen X, Generation X, and then there's the millennials, and then there's Gen Z. So I think it's important when you're looking at technology, be sensitive to those who are older, but definitely making it easy for people to access. Something that's very popular right now is MyChart. Every market I've been in, we always encourage people to use MyChart. So in Memorial, we actually set it as a goal to increase the percentage of MyChart activations. That makes it easier for the consumer to go online and have access to their medical records 24/7. You can even make appointments on there. So those things like online check-in, using kiosks, and then taking out the number of steps. I led a process improvement initiative when I had some ambulatory clinics, and we figured out it took an average patient 6 touch points before they saw a provider, and we cut it down to 2. So again, and we use some technology for that. So technology is good in of itself, but you still have to have the process. If you use it, like I said, AI, all that, it's a tool, but you as the administrator have to figure out how you can use this to ease access or convenience for your patient.
Well, I don't want to repeat anything you said. So I was thinking of some other examples. At Baptist Health, one of the last locations that we opened was the Miami Cancer Institute. And we thought of different innovative ways for patients to be cared for and to ensure their satisfaction. And one that comes to mind is Care Connect. So a lot of the patients that go to, we call it MCI, Miami Cancer Institute, that go to MCI many times spend the day there. It's like a whole day event, right? They're going for a variety of cancer care treatments and what have you. So Care Connect, when they walk in through the door, it's put on their shirt or what have you, and it tracks them. And it allows us to track their wait times. So if we see that a certain patient has been waiting too long, somebody will go tend to them and see why that patient has been waiting so long. And if they've been here all day and they've been waiting so long, somebody will go see if they need a snack or they need a drink or something. So it also allows us to, on the back end, from a PI perspective, to review well, if the patients are waiting so long and they're getting bottlenecked in this area, is there an opportunity to move our staff around so that we can move those patients along the continuum in a more effective manner? So I think that's a good example that they may not really know that that's what it's for, but it is, and it's been very helpful. And when I think of digital, I guess my two examples are coming from MCI, but in the pediatric chemotherapy infusion area, we leveraged digital. We worked with Disney and the Imagineers, and we set up virtual reality for the children. So when they're receiving their chemotherapy, they're watching a variety of options that they can watch on virtual reality, and it has been a great satisfier because they get to be entertained and immerse themselves in a completely different world and make their best attempt to forget what they're there for. And so it's just sometimes being creative, right? Thinking outside the box and seeing how we can leverage the technology that we have.
So I guess I would look at two things that I think are key, that are, I think, in existence right now. One is a little bit of a fledgling industry, but the other one certainly is out there. And that is simply an app. Back about 10 years ago, I was living in Dallas at the time. I saw IZETA Healthcare at one of the large entities in Dallas. And they connected me to an app back then. This was about 10 years ago. And I was able to communicate directly with my provider. I was able to download all of my lab blood work, which I'd love to see myself as a physician. And I was able to look at my bill. I was able to understand everything on one app, just one simple app. I was able to redo an appointment. And literally, that's how I book all of my flights. That's how I book my hotels. That's how I book my vacations. I do it all on an app. I do all my banking on an app. We should be able to do all our healthcare on an app. And we don't have that ability. And I can tell you, we do not have a full complement of access on an app at Steward. We're working on it. But if we did have that, it would be very beneficial to patients. I'd love to hear from Nancy Sindra if they do have an app that they're, I think you do, which is pretty much soup to nuts that you can have access to. But it's one very, very important part of technology. The other one that I would add there, which I think is still a potential industry that can grow monumentally, is home monitoring devices, especially for patients with chronic illness and chronic diseases. Home monitoring devices are really revolutionizing the way that we care for patients, the way that we prevent readmissions, the way that we prevent unnecessary admissions, and also the way that we facilitate the patient experience. And we can do anything remotely now, from blood pressures to weight. We can even, I have a device that a vendor sent me that's sitting in my bedroom that is the only FDA-approved 12-lead monitoring EKG. That gives you not just what an Apple Watch can give you, but a full 12-lead EKG that's FDA approved. So it's amazing what we can do remotely now to monitor patients and keep them safe at home and avoid unnecessary admission to our hospitals, which we all want to do if we want to survive in the years to come.
I just like to add to what Dr. Diaz said. One of the things I'm excited about that we're doing in Memorial Healthcare System. We are.
That's the experience.
I'll try again.
That wasn't me.
Okay, we are adding, we just purchased a software program, and it's another customer or client that you have to think of, your physicians. I was mentored early in my administrative career that most of us in here who are pure administrators, we don't bring revenue, we're an expense. The people who bring the revenue are our clinicians, but primarily our physicians. And so I've been through different relationships with physicians. Over the years, and as a senior leader in healthcare, I've been through different relationships with physicians. They've been customers, they've been partners, now they're colleagues, because there's so many physician executives. You know, every hospital now has a CMO. But I say that to say, I still like to see them as customers to a degree, because they bring business to your hospital. And so making it easy for them to access your scheduling system for your OR is critical, because as we know, surgical services is the biggest profit center in most hospitals. And the literature states as high as 65% in some hospitals, the margin comes from surgery. So we are deploying a software product that is going to make it easy for a physician's office to schedule in our ORs. It's like OpenTable, if you've ever used OpenTable to schedule. So that kind of thing, I think is really exciting, and it's kind of in the works now. But those are the kind of things I think we can think about. Again, how do we make it easy for our physicians to do business with us at our hospital?
So let's talk a little bit about what the world has been through, and with healthcare being at the fore. And I'm going to address this one to you, Dr. Diaz. How has the COVID-19 pandemic impacted strategies to engage patients in their care?
So you're giving me all the short questions, right? That ones that require just a little bit of an answer. So I can see about a third of the audience. So let me just ask, show of hands, who thinks that COVID changed healthcare? All right, hands down for a second. Who thinks that COVID changed healthcare for the better? Who thinks that COVID changed healthcare for the worse? All right, who thinks COVID changed healthcare forever? Right. So there you go, right? So we know that, and I think I made reference to this a little while ago, if you Google healthcare consumerism, the first thing that comes up is COVID changed healthcare forever, right? And I think what we took home from that is the fact that we can do things that we never thought we could do before. We can remotely triage patients for the emergency department. We can remotely care for a hospitalized patient at another hospital if we have a mid-level provider at hospital A and an attending at hospital B, and they may be 25 miles apart. And we can successfully do that, and more importantly, we can bill for that. So there's been all sorts of innovations and allowances that have been put in place. We can credential folks a little bit faster. We can facilitate the way that we carry our processes in the critical care areas, etc. So innovation really took a step forward in COVID, and a lot of it, the federal government has decided that, hey, this makes sense, so we're going to stick to it and keep pushing it, allow billing to occur in those circumstances. So I think when I look back, and I started with COVID on Tenet, and then over to Stewart in July of 2020, when COVID was just beginning to really take a hold in South Florida, and it was an eye-opening experience. But I think today we're better for the struggle we went through. Certainly a lot of people suffered, so I don't want to minimize that. But we're better as a healthcare industry because it really was an eye-opening. How do we become more flexible, more facile in what we do, rather than relying on this is the way we've done it for life, so this is the way we're going to keep doing it. So I think COVID was an eye-opening experience for all.
The pandemic, it is the worst infectious disease thing that I think the industry has been through. But I've been in healthcare long enough that I started out as an occupational therapist, and I'm from New York, and I say that the first AIDS patient that came to New York back in the 80s, that was maybe not a pandemic to the degree that the COVID was, but it was very serious. It was horrible. People were dropping dead, and no one understood how it was. They thought it was just among one population, then they spread. And the reason why I brought that up, and then I also saw us go through Ebola. Again, that is devastating, didn't take as many lives. But I just think that that experience just strengthened me. Like, I've been in healthcare for a long time, and I saw a lot of death, but I think it made us stronger, the ability to take care of patients and save a lot of patients during that time. Even though a lot of people died, a lot of people lived. So I think that's just healthcare. You know, we go through different stages where, and now I can even see with vaccinations, how now we all go walk and do what we want to with or without a mask. But I saw this, that society also adapt to HIV and AIDS. And then I saw a lot of hospitals put in decontamination centers in their EDs to deal with Ebola or any infectious disease. And now we have strategies to deal with COVID. And so it just makes us smarter, it makes us tougher. And those of us survive it, we're still here. And who knows what the next, I hope there's no more pandemics, but I'm not going to say that because there's been 3 of them in my healthcare career that have been devastating. But we always prevail in healthcare. And I remember when we were going through it at Texas Health, even though we were dealing with patients dying, and we did some really nice things, like whenever somebody survived and they left, we would stand in the hallway and clap, you know, when they left. So that was, and it was so rewarding to see people survive COVID. But that's healthcare. And I'm just saying, I guess this is more personal, but like I'm still here because I love this profession and that's what we do. So I think COVID has just made us, those of us who are still here, it just made us smarter and wiser, and we'll survive the next one. I hope there is no one. We'll survive.
It's definitely personal when you go through it. Yeah, there's no way around it. Nothing prepared us for that. But you know, I was thinking of telemedicine while you two were talking. I feel like COVID gave way to telemedicine to come in and just be everything that it has become. Telemedicine, I think of when we were in full lockdown and we couldn't allow our patients to have visitors. It was rough, you know, and there was a lot of people dying, and they were dying alone. So we had to think of plans, and you know, I know everyone thought of their own version of a plan, but I know that, for example, at Baptist, we partnered with our foundation, and they donated hundreds of iPads, and these iPads went to all the different floors so that we can put them in the patients' rooms, and the patients can have scheduled Zoom sessions with their family members, so they didn't have to feel alone. And it made us think different. It forced us to come up with how do we still create an opportunity for our patients not to feel alone and not to have the families devastated by the separation, and coming up with a variety of things. But you know, telemedicine, the iPads, those things allowed our patients to connect with other physicians, because again, there was specialties that just couldn't be everywhere. It was too difficult, and in the beginning it was very scary. So you didn't want to have a doctor have to go into every COVID room, because you couldn't afford to lose them, because he or she may have been the last doctor that you had that was not sick at that moment. So we had to get innovative. So yeah, COVID changed everything.
I think I can speak for not a time that we really want to go back, but we did learn a lot, and it has changed our industry. So in my line of work, and I'm going to address this one to you, Nancy, trust is so important. So what are some approaches for fostering patient trust and engagement, especially in our increasingly digital environment?
So yeah, trust is everything as far as I'm concerned. you can be the smartest, most effective physician, but if your patient doesn't trust you, then it doesn't really matter, right? Because they're not gonna give you them to care for. So trust is everything. I think the digital environment is tricky because then they need to trust us on a variety of levels. They have to trust us with their information on a digital platform and making sure that they feel that their information is protected. I think at the bedside, it's also so important with the healthcare team to create that connection. Many times when we are hiring individuals, I'm sure like your teams and everybody else, we do these panel interviews and we use these panel interviews to hire individuals. And a lot of times I feel like it's great that we have all these wonderful professionals, but these were great and this one was great and nice. And at this point, in your 20s and 30s, I can no longer teach you to be nice. I can teach you certain skills, but can you connect with the person that's gonna trust you with their life? That's important. Can you look at someone in the eye and make a connection so that suddenly their blood pressure does go down because they feel better and they trust you and they're not as scared. So, you know, it's such a wide array. We're, like I said, we're caring for patients in so many different ways, but you have to be able to connect. And for the young leaders in the room, you have to be able to connect. You have to find that within your heart, within yourself, to quickly remind yourself why you went into this business to begin with, because you have to be able to connect with the patient. If they can't trust you, even when, as a leader, because by the time we're called, we're just addressing issues many times, right? But they have to trust that you are going to take care of that issue. You are going to follow up. You are going to help them. And so trust is so important. It's probably a couple of notches after safety.
And if you're a clinician, I do think it's really important to remember your why. Even though I'm an administrator, in some ways I'm still that occupational therapist who wanted to save the world. I've matured, and I know I can't save the world, but one of the things that I like is that when I always think about my philosophy, and to understand how I establish trust with patients, it's being very mindful and being present and listening. And I learned that as an occupational therapist, because when you're sitting there trying to evaluate a patient who has come through a horrible injury, and now you're trying to help them adapt to life with some type of disability, you know, you learn to listen and be mindful. And you don't always have to have had a traumatic injured patient, but when you're a clinician, one of the biggest things you can do is looking at a patient in the eye. I remember when my husband was a patient at a hospital that was known, they were legendary for customer service throughout the country, just happened to be in my backyard. And I watched, and everybody who came into that room looked at him in the eye. And my husband was so impressed with the care or the experience that he said, I'm getting VIP treatment. I said, no, you're not. I don't know anybody in the system. These are competitors. And they were. My husband was 45 minutes away from my house. But what I watched is that everyone who walked into that room looked at him in the eye. They called him by name, you know? So you have to take time out, particularly as a clinical person. Mindful, be present, remember your why, and listen. And that's how you start to garner trust, I think. And as an administrator, I think grounding is really important because we have so much work to do, and you usually in your office or in a meeting. But I know because I come from the clinical ranks, when I get like real frustrated with management stuff, I go and ground. Because I go and I ground with our patient experience person. Her name is Brianna. I walk in and out of rooms with her. I listen. I ask people what you know, if you had a bad experience, I listen. You know, I don't defend the organization. I just listen, and then I apologize, and I figure, okay, what can we do to recover this case? You know, well, how can we make it whole for this patient? But I think that's how you garner trust, is that you listen and you don't minimize what they're telling you. And it's hard. I'm not gonna say it's easy to do that 24/7, but the other thing is healthcare professionals, you have to take care of yourself too. You have to find ways to manage your stress so that you can be there and be mindful and garner the trust.
I have to add to you because I'm a recreational therapist.
You are.
So, I'm listening to you and we are speaking the same language. That rehab background of working in teams and connecting with your patients, it's like the basis of what we were taught. And I connected with Juan here. We made that eye connection because he knows when I'm having a bad day and I'm done being an administrator, I go around on patients. That's what I do. Because even if they're complaining, it's okay. Sometimes they just want someone to listen. And when they're done saying everything they have to say, they feel so much better. I'm like, okay, do you want me to do it? No, I'm good. So I just thought you were talking, I'm like, she's speaking my language.
So I love going last and answering these questions because Sandra sounds so smart. All I have to do is say, oh yeah, what they said. Let's echo what they said. And I love what Sandra said about the VIP treatment, and that's exactly right. Look, if you want to break down barriers, if you want to really do the best you can, one of the things that I would really recommend as far as trust and engagement is to break down those barriers, to make sure that we make it as easy as possible for the patients to feel more engaged within the community, more engaged, and sort of de-institutionalize the institutions that we all work with, right? Because nobody wants to go into a cold box after they get their health care. They want to go somewhere where they're going to get that personal touch, where they're truly going to feel like a VIP. I did a little bit of research prior to this meeting, and one of the things that I looked at is what exactly does Chris Gainey say specifically when it comes to trust and engagement. And one of the things that they had in one of the white papers is essentially just that. How do you break down barriers that ease the access in and out of this? And let's not forget that healthcare, or the burden of receiving healthcare in 2024, does not end when you leave the facility or when your treatment is done. It ends after you get that final bill and you finally pay that final bill. So the whole process of billing the patient and all those encounters back and forth are so critical, because you could have the best experience in the world at a healthcare facility and then get slam dunked by some rude person who's going to call you and say, why the hell haven't you paid the bill? And other expletives. So it is really important for us to look at the entire continuum, soup to nuts, if we want to really have that trust with our patients all through the entire encounter all the way to the end.
All right, Dr. Diaz. Well, you just kind of hit on my next question. I'm going to ask it to you. I'll start with you. Where does price transparency fit into the equation? How will it impact consumer opinions and behavior?
Yeah, that's a really tough one to answer, because price transparency means so many different things to so many different people. I often make reference to the co-pays or the burdens that patients carry as a co-pay. If you take, for example, a person that works in, let's say a bus driver. I want to take it away from fairness. Let's say that you take a bus driver and a neurosurgeon, and you both have them go in for an appendectomy. So the neurosurgeon has great insurance, and so does that bus driver, because they both have great active jobs. But the copay for the neurosurgeon is $4,000, and the copay for the bus driver is $4,000. Well, that's 10% of the bus driver's salary for the year, but it's only 1/100th of a percent of the neurosurgeon's salary. So what price transparency means for one person is not necessarily the same thing that means for another person. And I'm using an extreme example, obviously. But also the healthcare reimbursement system in the US is so damn complicated, and we have made it so hard. We're the only country on the planet who healthcare is dependent on whether or not you have a full-time job with a reputable company that employs more than 20 people. That's not the case anywhere else. I'm not gonna go down the path of talking about healthcare economics because that would be a whole other 90 minutes plus. But I can tell you that price transparency and our ability to understand the payment and reimbursement system is the key to success, not the actual price transparency. So, I mean, what the heck does it mean to you if some hospital publishes the fact that the deck is $25,000? Do you think that's what Blue Cross Blue Shield pays the hospital? No. So, what exactly is price transparency? I don't have a good answer for you, unfortunately, but that's the best I can do.
Yeah, to Dr. Diaz's point, that's a tough one, but price transparency is necessary. So as I said in the beginning, that today's consumer, they're looking for access, convenient location, and cost. Because more and more have very high deductibles, and you have to meet that deductible. So people do pay attention to that. And it's more in the ambulatory services arena. And so the thing that I've seen done, and I've done it myself, if I'm gonna get a mammogram, I'm gonna look at how much I'm gonna pay. So in one market that I was in, my part was $200 because I had a high deductible. And in one place it was $800. Now that was in a different market. That was in the Michigan market, in the Northern Ohio market. But I paid attention to those because I had a very high deductible. For the plan I chose from my employer, I had a high deductible. So I think that even though, to Dr. Diaz's point, it's a very challenging thing to deal with. And then when you do, like I remember the Detroit Medical Center was pretty innovative, and it was really hard because, again, running therapy clinics, we would say what our prices are, but then patients would ask for a discount, but you know it's hard for us to give a discount because for single pay you don't give discounts, even though we give them to the big insurance companies. So it was really challenging to try to find a way to help our mothers pay for speech and language pathology. So it's not an easy answer, but you do have to be cognizant of that because people with high deductibles are going to want to know what the cost is. And some of them will make a choice based on the cost. So it's just something that we have to tackle. We haven't done a good enough job as an industry yet, but it's coming.
Yeah, I'll agree to that. I think we've done a great job as an industry with that. However, there's so many aspects of healthcare, like to Dr. Diaz's point. I mean, if you're in need of an appendectomy, you're gonna have to get it wherever and however, right? There are certain things that the price at that point, we have an emergency and it's not gonna matter. But at the same time, there's the mammographies of the world or the lab work or what have you. And I think that consumers, they have to get educated and have to have a better understanding of what their coverages are and deductible versus co-payment versus co-insurance and all this lingo that to us is very normal. But when I speak to to friends and family members, and they're looking at me like I have two heads, and they don't really understand. And so it's almost like what the cost of the care sometimes, if they don't understand what and how their insurance works, it's irrelevant, right? So the consumer has to be educated themselves in what they've purchased and what that means and how that's spelled out, so that then they can, when available and when possible, shop for the health care as they can. I mean, there's, back to the point of the ED, it's irrelevant, right? You're gonna have to deal with, and also, to the doctor's point of whether the insurance company pays us or doesn't pay us for certain things a certain way, when the consumer sees a bill, and we've all heard our family members say, they charged you what for Tylenol? Or they charged, and then you try to explain that doesn't mean anything, but it's very complicated. So, we really haven't done a good job of simplifying, and I'm not sure that we can honestly be transparent if we don't simplify how we get paid and how things actually work. I don't know that you got the answer you were looking for.
I think I took some. So we touched on a lot of topics, a wide range of questions regarding consumerism and patient experience, and I do want to open up for some questions. But before I do want to thank our panelists for taking the time out of their busy schedules. There goes a lot of hard work into setting up for this event, and Charles and Juan for putting this together in the ACHU. But let's get going. So I do want to turn it over to you guys and ask for some questions. I know there's some burning questions out there.
Good afternoon, thank you. My name is Serge Michelle, I'm a student here. My question to the panelists, we talk about patient safety, we talk about trust, we talk about minimizing errors, and there's also a component to where I think Ms. Sneed mentioned how healthcare providers have to take care of themselves. Are there policies in place to kind of minimize burnout? When it comes down to a healthcare provider, how do you monitor that they're not burning out? Is it having mentorship, having resellers there? Like, what are the steps to minimize burnout to where they can provide that safety and minimize these errors?
Good question.
That's a hard question. There's no policies that I know of that are in place to prevent burnout. I think the leadership has to encourage staff. Now, I will tell you, let me backtrack. So let's look at physicians and residents. They used to just work nonstop. Now they can't. We can't just use them. They can't just work 24/7. So when you're a teaching hospital or academic medical center, you cannot burn out your residents the way like 20 years ago was okay. So that is one thing that's happened in the physician community. At the system I worked, we would monitor anyone who worked over 100 hours in a pay period. So if you think of a pay period as 80 hours, anyone over 100, we would be alerted to that person, that team is working, someone's working, that was at Texas Health, my previous employer. So those are two things to your question that I know of that are formal, but it really is us as leaders modeling the behavior. I had a supervisor one time, and she had some work done, and she had a lot of swelling, and then she comes to work with an ice pack on, and she says, "I want to show people that you come no matter what." And I just thought to myself, I didn't know what to say. She was my boss, so I'm like, okay, now. Versus like, I had the same type of work done on my mouth yesterday, and I did go in for like a half hour, and it was so swollen, it was just really bad. I said to my boss, and he looked at me, he said, "Go," because you could see. But so that's the difference, and like what the environment that tells me it's okay after a dental procedure that leaves me swollen and hurts to talk, to go home and spend the rest of the day, versus someone who says, being stoic. And so that's what I'm saying, you set the tone. It's okay for you to take care of yourself. I think that comes to us to role model the behavior. But I don't know of a lot of policies yet that force caretakers to only work a certain amount of hours. But it's really important because you're human, and so if you burn yourself out, you also are more risk for error. So I think that's something that we as administrators have to really be careful with our staff to not overwork them or encourage them to, or set the culture that says it's okay to say I don't feel good. It's okay to leave half a day if you're really sick.
Yes, it's sometimes, the leaders have to be on top of that. I know as an organization, we re-looked at like PTO policy. Like we found that especially during the pandemic, everyone was overworking and people were not taking PTO. We're like, okay, no, you gotta take PTO. You gotta check out sometimes. We need you, but you gotta take a break. And I was thinking of you as you were saying you're looking for imaging folks. I used to be over imaging at one of our hospitals. in my previous role. And, you know, we had to be on top of our staff because the staff not only works overtime at your hospital, but then they have these per diem gigs at other places, right? And so before you know it, they're just working all the time. And we go back to safety, and is that safe? So we really had to make sure that our supervisors and managers understood where else is your staff working, right? Because we may think they're working 100 hours for us, but then it's 100 with us and everything else everywhere else. So it's having that relationship, that open communication, and, you know, sometimes you have to make hard calls. Yes, we need you, but you're way past your hours and you need to take time off. So it's the right thing to do for the employee, but and more importantly for the patient, to be honest with you, because it becomes a safety issue for sure.
Nancy just made me think of a real situation that I dealt with in my former employer. And I say that because everyone in here is an administrator or going to be one. If you look at your staffing models and be an advocate for careful staffing models. So like I was working in a safety net and I saw something that I didn't agree with. It was how we staffed our on-call imaging technologists. So you would work a 12-hour day, and then you would go home and be on call. And so we had this person work 12 hours, he was on call, he came in once. The second time he was called, he overslept. So he was called at 3 a.m. He overslept, they couldn't get him into 7. So we missed the MRI on a patient who had a stenosis in his cord. It was demyelinating and it was problematic. And it was a really egregious event, and I had been advocating that this is not how we should staff this department, because who can work 12 hours, go home, and be called in once, and then be called in. And so it took a lot of, advocating, but we then said we now have 24/7 MRI and 24/7 CT. And we started to staff, so we didn't staff by using on-call. So those are the kind of things you have to think about. Now, you might think it's more cost-effective, and this is where the COO or the CEO has to really work with their finance people. But I'm being very serious because I'm not going to divulge a lot of information because of HIPAA, but you can harm a patient like that. And then you put your employee in a very precarious situation as well. So I think you have to, as administrators, be careful about your staffing models and make sure you're not setting people up to be, to human and be fallible. We're all fallible, but you set them up, and I had to share that experience that it took a lot to get 24/7, but that was the most appropriate way to staff that department.
And I promise you we didn't plant that question, but that leads us right into the end of our presentation. We promised you an hour and a half, and it's been an hour and a half. So we want to thank you all for coming out this evening. Again, thank you to the ACHE of South Florida for hosting this event. I'm going to just turn it over to Charles Felix to close us out.
Again, thanks for coming tonight. On some of the tables, you will see a QR code. Very important. Please use that QR code tonight to survey us, to see how we've done, to give us some ratings so we know we did well or we need to do better. We appreciate that. And for our panelists, we will be making a donation to the ACHE Scholarship Fund in your name this year. And with that, thank you for coming. Thank you for Florida Medical Center for hosting us. And everybody drive home safely. Thank you.